Every 8 seconds, someone dies because of diabetes. Not from sugar, but from what high insulin does to the human body. And most patients are never told why their treatment fails. Why diabetes is deadly. Diabetes is responsible for millions of deaths each year, primarily through heart disease, stroke, kidney failure, and infections. In the United States and Europe, diabetes is among the top 10 causes of death. Yet most people believe diabetes is only about high blood sugar. That belief is medically incomplete. What diabetes actually is. Diabetes is a disorder of insulin regulation. Insulin is a storage hormone. Its job is to push glucose into cells. In type 2 diabetes, insulin is present often in excess, but the cells stop responding. This condition is called insulin resistance. As insulin rises, fat storage increases, inflammation increases, and blood vessels are damaged. Types of diabetes. There are 3 clinically recognized types of diabetes. Type 1. Autoimmune destruction of insulin-producing cells. Type 2. Insulin resistance with excess insulin. Gestational, pregnancy-related insulin resistance. This video focuses on type 2 diabetes, which represents over 90% of cases. Comment below which type applies to you or your family. The biggest treatment failure. The most common diabetes treatment strategy is to increase insulin. This lowers blood sugar temporarily, but worsens insulin resistance over time. This is why many patients require more medication every year. The root cause, chronic high insulin, remains untreated. Here is the Dr. Jason Fung's 3 golden principles that helps thousands of people to reverse diabetes. Principle 1. Lower your insulin, not just sugar. Dr. Jason Fung emphasizes that insulin is the key driver of type 2 diabetes. If insulin stays high, fat burning stops and resistance continues. Lowering insulin allows the body to access stored fat and restore sensitivity. Principle 2. Reduce eating frequency. Every time you eat, insulin rises. Frequent meals mean insulin never drops. Time-restricted eating and intermittent fasting create low insulin windows, allowing cellular repair. But very important thing is, fasting should be medically supervised, especially for patients on insulin or sulfonylureas. Principle 3. Reverse insulin resistance. Insulin resistance improves when excess fat is removed from the liver and pancreas. Weight loss, carbohydrate reduction, and fasting all target this mechanism. This is how some patients achieve diabetes remission. Foods that lower HbA1c. HbA1c reflects long-term glucose exposure. Foods that lower HbA1c work by reducing insulin demand and inflammation are leafy greens. Low glycemic load, high magnesium, improves insulin signaling. Eggs and fatty fish. Protein and omega-3 fats reduce post-meal glucose spikes. Nuts and olive oil. Slow gastric emptying, lower insulin response. Fermented foods. Improve gut microbiota, linked to better glucose control, but portion control still matters. Calories and context are critical. Final medical disclaimer. Type 2 diabetes is serious, but it is not always progressive. Medication manages symptoms. Metabolic strategies address the cause. Never stop medication without medical supervision. If you want evidence-based health education, subscribe.